So next is class 1 sodium channel blockers. So in what is the mechanism of action in what these agents will block the specific channels and decrease the threshold for excitability. So it will decreases the conduction velocity in the fast response tissue and increases the QRS duration. So this drugs will inhibit the triggered activity raising from delayed after depolarization. So delayed after depolarization in shortcut we can call as the DAD, or early after depolarization is named as EAD. Early after depolarization is EAD, and it will shift the voltage dependence of recovery from inactivation to more negative potential. So this is the mechanism of action of class 1. So in this first drug is quinidine sulfate. So it is a prodrug of the class 1A anti-arrhythmic agent. So it is extracted from the cinchona tree. So it is then alkaloid extracted from the cinchona tree, and it has the anti-malarial activity also. So this is the structure, and this is the IUPAC name, that is 5-ethynyl 1-aza bicyclooctane 2-yl 6-methoxy quinoline 4-yl methanol sulfate. I will repeat it again, that is 5-ethynyl 1-aza bicyclooctane 2-yl 6-methoxy quinoline 4-yl methanol sulfate. So if you see the structure here, this is the quinoline. See here, this is the quinoline. In the 6th position, the methoxy group is attached, and here this 4th position of the quinoline is attached to here methanol is there. See here CH3OH. Here methanol, and here aza bicyclo. Two cycles are there, so that is bicyclo. Aza means nitrogen. Nitrogen means aza. So aza bicyclo, it is a 8-membered ring. So 8-membered ring is octane 2-yl. So in second position it is attached to the methanol group. So it is 2-yl. In the 5th position, the ethyl group is attached. 2 carbon atoms are there. So that is ethyl, and here sulfate. So if you see the structure here, 5-ethanol 1-aza bicyclooctane 2-yl, and here 6-methoxy quinoline 4-yl methanol sulfate. So this is a structure and IUPAC name of the quinidine sulfate. So properties are, it is a white or almost white crystalline powder. It is insoluble in acetone and slightly soluble in water and soluble in boiling water and alcohol. So it is, the quinidine is isolated from the cinchona bark. So next, pharmacokinetics, it is available in the form of the salt. So quinidine sulfate or gluconate hydrochloride. So it is available in the form of the salt. So this drug is administered through the oral route. So it is oral route of administration, and 3/4 of the drug it will reaches the systemic circulation. So this drug has been metabolized in the liver through hydroxylation reaction. About 20% of the drug is excreted through the urine in the unchanged form. So it is the plasma protein bound drug. About 80 to 90% of the drug will bind it to the plasma protein. Next, adverse drug reactions are nausea, vomiting, diarrhea, thrombocytopenia means decrease the number of platelet count in the blood. Next, hypersensitivity, headache, tinnitus means ringing of the ears, and blurred vision means can't able to see properly, and loss of appetite means loss of hungry, stomach pain, tremors and weakness. So uses it is used for the long term treatment of the ventricular premature depolarization or to reduce the ventricular tachycardia. Tachycardia means raising of the blood pressure after cardioversion of the arrhythmia. Next, prosinamide hydrochloride. So it is an amide derivative of the local anesthetic. So procaine, it shows a similar mechanism of action. So as the procaine is the local anesthetic, as the procaine has it shows its activity in the same way only the prosinamide drug has the similar mechanism of action and pharmacological effects and its uses as that of the quinine. So with some of the differences in the pharmacokinetic and pharmacological parameters means the procaine and prosinamide drug. Procaine is a local anesthetic and prosinamide we are using in the treatment of the arrhythmiasis. So these two drugs have in the similar mechanism of action and pharmacological effects and uses, but it is different only in the pharmacokinetics and some of the pharmacological parameters, like it has the less potent and minimal antivagal action, and it decreases the contractility and AV conduction to lesser extent, and it does not block the alpha receptors, so the blood pressure will fall minimal and is mainly because of the ganglionic blockage. So this is the structure and this is the IUPAC name. So if you see the IUPAC name, that is 4-amino and 2-diethyl amino ethyl benzamide hydrochloride. That is 4-amino 7 2-diethyl amino ethyl benzamide hydrochloride. So if you see the structure here, this is the benzamide structure with 6-member ring and carbon double bond oxygen and NH. So this commonly known as benzamine. In the fourth position amino group is there, and here 1 2 carbon atoms means ethyl. So for here ethyl, here 1 2 ethyl groups are there. So that is in second position diethyl amino, and this is the hydrochloric acid is attached. See here 4-amino 2-diethyl amino ethyl benzamide hydrochloride. So this is the structure and IUPAC name, and the properties are it is a white crystalline powder, odorless means it does not have any odor, and soluble in water, alcohol, slightly soluble in chloroform, very slightly soluble in water and ether, and it is more stable in water. And the pharmacokinetics are it is oral, intramuscular and intravenous route of administration. So the drug undergoes the first pass metabolism and which gives rise to the active metabolite, that is N-acetylprosinamide. So it undergoes the first pass metabolism. In this active metabolite is N-acetylprosinamide sorry, which lacks sodium channel blocking activity but blocks the efflux of the potassium ions. So 50% of the administered drug is excreted unchanged form in urine. Adverse drug reactions are nausea, vomiting, bitter in taste. So when we administer the drug, somewhat bitter in taste. And thrombocytopenia means reduce of the number of platelet count in the blood. Anemia, hepatitis means it will affect the liver. Hypersensitivity, so rapid Intravenous administration leads to the hypertension, is raising of the blood pressure, fever, rashes and itching, depression, hallucination and dizziness. Next uses, it is used in the treatment of the arrhythmias, alcohol withdrawal, ventricular fibrillation, and it is also used against the premature atrial contractions. Next, diisopyramide pyramid phosphate. Next drug name is diisopyramide phosphate. So this drug shows a similar cardiac electrophysiological activity. So it shows a similar electrophysiological activity as the quinine and prosinamide drugs shows. So it is used as a substitute for above two drugs, that is prosinamide hydrochloride and quinidine sulfate, because it shows a similar activity as the drug shows like quinidine and prosinamide. So it can be used as a substituent in place of these two drugs in order to prevent the ventricular tachyarrhythmias. So this is the structure and this is the IUPAC name, that is 4-bis propane 2-yl amino 2-phenyl 2-pyridine 2-yl and butamide phosphoric acid. See, 4-bis propane 2-yl amino 2-phenyl 2-pyridine 2-yl butanamide phosphoric acid. So if you see the structure here, 1, 2, 3, 4. 4 carbon atoms are there. So it is butane, and here amide group is said, so butanamide. In the second position, phenyl group, and here in the second position, pyridine structure is there. So this pyridine structure of the second position is attached to the carbon atom. So it is pyridine 2-yl. And here in the fourth position, here propane is attached. Two propane groups are there. So it is this propane. This propane second position is attached to the fourth position of the butane. So it is propane 2-yl amino and phosphoric acid. See here, 4. This means 2. Propane 2-yl amino 2-phenyl 2-pyridine 2-yl butanamide phosphoric acid. Next properties are, it is a white or almost white powder and it is soluble in water, sparingly soluble in alcohol and insoluble in methylene chloride. So it is 4-bis propane 2-yl amino 2-phenyl and 2-pyridine 2-yl butamide phosphoric acid. So it is the structure and IUPAC name, and the properties are, it is a white or almost white powder and it is soluble in water and sparingly soluble in alcohol and insoluble in methylene chloride. Next, synthesis. So synthesis is involved in the three-step process. So in the first step involves the preparation of the 2-phenyl, 2-pyridine, 2-yl acetonitrate from 2-phenyl acetonitrate. So the starting material is 2-phenyl acetonitrate when it is reacted with 2-bromopyridine. When it is reacted with 2-bromopyridine in presence of sodium amide, here what will happen? From the 2-phenyl acetonitrate, here one of the hydrogen, and from 2-bromopyridine one of the bromine is eliminated. So remaining the pyridine structure is attached to the 2-phenyl acetonitrate. See here, the acid pyridine structure has been attached, so it is 2-phenyl 2-pyridine 2-yl acetonitrile. See here, when 2-phenyl acetonitrile, when it is reacted with 2-bromopyridine in presence of sodium amide, here one of the hydrogen atom from the 2-phenyl acetonitrile and one of the bromine from the 2-bromopyridine is eliminated. So remaining pyridine structure has been attached to the 2-phenyl acetonitrile to get 2-phenyl and 2-pyridine 2-YL acetonitrile. So this is the first step. And the second step, the preparation of the 4-diisopropyl amino diisopropyl amino 2-phenyl 2-pyridine 2-YL butanitrile from 2-phenyl 2-pyridine 2-YL acetonitrile. So this 2-phenyl 2-pyridine 2-YL acetonitrile is the end product in the first step. So it became the starting product in the second step when it is reacted with 2-chloroethyl and isopropyl propane 2-amine. See here in the second 1, 2. In the second position chlorine is there. So 2-chloroethyl and isopropyl. So isopropyl and propane 2-amine. When it is reacted in presence of sodium amide, here the hydrochloric acid is eliminated. See here from 2-phenyl 2-pyridine 2-YL acetonitrile, one of the hydrogen, and from N 2-chloroethyl and isopropyl propane 2-amine, the chlorine atom is eliminated. So remaining the N-isopropyl propane 2-amine is attached to the 2-phenyl 2-pyridine 2-YL acetonitrile to get 4-diisopropyl amino 2-phenyl and 2-pyridine 2-YL, and this is butanitrile. See here in the second step, 2-phenyl 2-pyridine 2-YL acetonitrile when it is reacted with N 2-chloroethyl isopropyl propane 2-amine in reacted in presence of sodium amide, the hydrochloric acid is eliminated. So one of the hydrogen atom from the 2-phenyl 2-pyridine 2-YL acetonitrile and chlorine atom from the 2-chloroethyl and isopropyl propane 2-amine. So to get the 4-diisopropyl amino 2-phenyl 2-pyridine 2-YL butanitrile. So this is the second step. Next is third step. Here the preparation of the diisopyramide phosphate from 4-diisopropyl amino 2-phenyl 2-pyridine 2-YL butanitrile. So this is the end product in the second step. So here it becomes the starting material for the third step. That is 4-dis isopropyl amino 2-phenyl 2-pyridine 2-YL butanitrile in presence of the sulfuric acid to get diisopyramide in presence of the phosphoric acid, we will get the diisopyramide phosphate. See here 4-diisopropyl amino 2-phenyl 2-pyridine 2-YL butanitrile in presence of sulfuric acid. Here we will get the diisopyramide in presence of this phosphoric acid. We will get diisopyramide phosphate. So this is the synthesis of the diisopyramide phosphate. I will explain it again. In the step 1, from the preparation of the 2-phenyl, 2-pyridine, 2-vial acetonitrile has been prepared from the 2-phenyl acetonitrile when it is reacted with 2-bromopyridine in presence of sodium amide. Here the hydrogen bromide has been eliminated. One of the hydrogen is from 2-phenyl acetonitrile and bromine from 2-bromopyridine is eliminated to get 2-phenyl, 2-pyridine, 2-vial acetonitrile. The second step, 2-phenyl, 2-pyridine, 2-vial acetonitrile when it is reacted with N, 2-chloro isopropyl propane 2-amine in presence of sodium amide. So the hydrochloric acid is eliminated. That is, one of the hydrogen is eliminated from 2-phenyl, 2-pyrimidine, 2-vial acetonitrile and chlorine from 2-chloroethyl isopropyl propane 2-amine. So remaining isopropyl propane 2-amine is attached to the 2-phenyl, 2-pyridine, 2-vial acetonitrile to get 4-diisopropyl amino, 2-phenyl, 2-pyridine, 2-vial butanitrile. In step 3, then 4-diisopropyl amino, 2-phenyl, 2-pyridine, 2-vial butanitrile is reacted in presence of sulfuric acid. We will get diisopyridine, diisopyramide. In presence of the phosphoric acid, we will get diisopyramide phosphate. This is a final drug what we want. So this is the synthesis. Next, pharmacokinetics. It is oral and intravenous. Route of administration, and it undergoes the metabolism through the liver by using an dealkalization reaction, and the drug is eliminated in the urine in unchanged form. Adverse drug reactions are headache, constipation, dry mouth, nausea, vomiting, urinary retention, abdominal pain, blurred vision, dizziness, dry nose and dry eyes, low blood sugar, sweating, liver problems, stomach pain, shortness of the breath, heart failure, sudden weight gain and allergic conditions. Next uses, it is used as the anti-arrhythmic agent to suppress and treat the ventricular or supraventricular arrhythmias. So it is mainly act as the anti-arrhythmic agent. Next is lidocaine hydrochloride. So it is a drug used in the treatment of the ventricular arrhythmias, and most commonly it is employed for the local anesthetic also. So it has the two activities, that is arrhythmias, anti-arrhythmic and local anesthetic. So this is the structure, and IUPAC name is 2-diethyl amino N 2,6-dimethyl phenyl acetamide hydrate hydrochloride. See here 2-diethyl amino N 2,6-dimethyl phenyl acetamide hydrate hydrochloride. So this is the phenyl. For the phenyl in the second and the sixth position, the methyl groups are there. So that is dimethyl, and this is amino. And here 1, 2. In second position, the diethyl. So 2 ethyl groups are there. So that is diethyl amino. It is the acetamide hydrochloride. See here 2-diethyl amino 2,6-dimethyl phenyl acetamide hydrochloride. So this is the structure and IUPAC we skin. And the properties are it is a white crystalline powder and soluble in water and freely soluble in alcohol. So next pharmacokinetics, it is not administered through the oral route. So it is not administered through the oral route, and it is readily almost completely metabolized in the liver through hydrolysis and ethylation and conjugation reaction. So instead of given of the oral route, it should be given through the intravenous route of administration, and the metabolites are eliminated in urine. So this drug is not preferred for oral route. So instead of the oral route, we should give it through the intravenous route of administration, and it has been metabolized in the liver, and remaining inactive metabolites are being excreted in urine. So adverse drug reactions are hypotension means low blood pressure, swelling, redness at the site of injection because this drug has been taken through the intravenous route. So at what site we have taken, at that site we can see the redness, skin irritation, and the change in the skin color means red or purple spots can seen on the skin, nausea, constipation, vomiting, confusion, getting of the dizziness, headache, and convulsions, drowsiness, numbness, and tremors, irritation symptoms, redness, swelling, and cardiac arrest, abnormal heartbeat, seizures, severe allergic reactions, blurred vision means can't able to see properly, slurred speech means can't able to speak properly. So uses it is used as local anesthetic and also used in the treatment of the arrhythmias. So it has two activities, that is local anesthetic agent and an anti-arrhythmic agent. Next one is mexiletine hydrochloride. So next drug is mexiletine hydrochloride. So it is basically the local anesthetic drug. So it has two activities, that is anti-arrhythmic activity and local anesthetic activity. So it shows the chemical and pharmacological activity is equal to the lidocaine. So the lidocaine and mexiletine has a similar activity, pharmacological activities. So there only the difference means it does not undergo the first pass metabolism. Means this drug does not undergo the first pass metabolism, and hence unlike can administer oral route. So the lidocaine is the intravenous route of administration. So this mexiletine is the we can take through the oral route of administration, and this is the structure, and this is the IUPAC name, that is 1,2,6 dimethyl phenoxypropane 2-amine hydrochloride. 1,2,6 dimethyl phenoxypropane 2-amine hydrochloride. So if you see in the structure, this is the phenyl. In second and the sixth position, the phenoxy group, dimethyl groups are there, and here this is the phenoxy, and 1, 2, 3, 3 carbon atoms are there, means propane. For the propane in the second position, the amine group is attached, and this is the hydrochloride. See here 1,2,6 dimethyl phenoxypropane 1, 2, 3 means propane, 2-amine hydrochloride. So this is structure and IUPAC name. So next properties are it is a white crystalline powder, and it is bitter in taste, and it is insoluble in water and alcohol. And pharmacokinetics, it is the oral route of administration, and it undergoes the metabolism through the cytochrome enzymes. So this oral belongs to the cytochrome enzymes, and it is eliminated through the kidneys in unchanged form. And adverse drug reactions are nausea, vomiting, dry mouth, hypotension means reduce the blood pressure, and thrombocytopenia means reduce the platelet count in the blood. Tremors, blurred vision, Decreased appetite means decrease the feeling of hunger, stomach upset, diarrhea, constipation, depression, headache, dizziness, feeling of the tiredness, weakness, and heat burn. So it is used in the treatment of the arrhythmiasis, and it is employed in the patients who are unresponsive to lidocaine. Means the person, those who are not giving any of the response to the lidocaine drug, no, for that condition we can able to use this drug, and also it is used for treating the ventricular tachyarrhythmiasis following myocardial infarction. So next, tokenide hydrochloride. So it is available in the form of the hydrochloride salt and a primary amine analog of lidocaine. It exhibits as the 1B anti-arrhythmic property. So it stabilizes the neuronal membrane by reversibly binding to and blocking open and inactivated voltage get sodium channels. So it will inhibit the inward sodium current required for the initiation and conduction of the impulse, and it will reduce the excitability of myocardial cells. So this is the structure, and IUPAC name is 2-amino and 2,6-dimethyl propionamic acid hydrochloride. 2-amino and 2,6-dimethyl propionic acid hydrochloride. See here structure, this is a phenyl. For the phenyl here in second and the sixth position, the two methyl groups are there, and here 1, 2, 3. 3 carbon atoms is there, and so it is a propionic acid. In the second position, the amine group is there, and it is hydrochloric acid. See here, 2-amino 2,6 dimethyl phenyl propionic acid hydrochloride. Next properties, it is a white crystalline powder with bitter taste, and it is freely soluble in water. So pharmacokinetics are, it is the oral route of administration, and it undergoes the negligible first pass hepatic degradation. So no active metabolites has been formed, and it is excreted by the kidneys. So it does not undergoes any metabolism process directly. It is excreted by the kidneys. And adverse drug reactions are dizziness, spinning sensation, tiredness, stomach upset, decreased appetite means decreased of the hungry, diarrhea, headache, nausea, vomiting, blurred vision, confusion, numbness, and tremors, sweating, low blood pressure, and fatigue. So it is used to treat the premature ventricular contraindications and ventricular tachycardia. So next drug is phenytoin sodium. So phenytoin sodium is available in the form of the sodium salt form. So it also having the non-sedative anti-epileptic agent and also anti-convulsant activity. So it has anti-arrhythmic agent, anti-convulsant activity, and anti-epileptic agent. So it will promote the sodium efflux from neurons, and which is located in the motor cortex. So it will stabilize the neuron and inhibit the transmission. This is the structure, and if you see the IUPAC name is sodium 2-hydroxy 4-4 diphenyl imidazole 5-olate. See here, sodium 2-hydroxy 4-4 diphenyl imidazole 5-olate. See here, this is the imidazole. This 5-member ring with 2 nitrogens are there. So imidazole. In second position, hydroxyl group is there. In fifth position, oxygen, and in fourth position, 2 phenyl groups are attached. And this is the sodium. See here, sodium 2-hydroxy 4-4 diphenyl imidazole 5-olate. So this is a structure and iopathy. Next properties are, it is a white crystalline powder and it is slightly hygroscopic in nature. So the meaning of the hygroscopic is if the compound exposed to the moisture, exposed to the atmosphere means it is ready to absorb the moisture from the atmosphere and it is insoluble in methylene chloride and soluble in water and alcohol. So pharmacokinetics, it is the oral, intramuscular and intravenous route of administration. It undergoes the metabolism through the cytochrome enzymes and it is eliminated through the urine in unchanged form. Next, adverse reactions are headache, nausea, vomiting, constipation, antigenous, feeling of spinning, drowsiness, and they can't able to sleep properly, this trouble sleeping, nervousness, and swelling, bleeding of the gums, confusion, blurred vision, and rashes, joint pain, depression, and liver problems, stomach pain, abdominal pain. So sometimes the person may can also get the suicidal thoughts. So means they will get the thought of committing suicide. Next uses, it is used to prevent and control the seizures. Means it is also having the anti-conversion activity or anti-epilepsy activity and also it is used in the treatment of the anti-arrhythmic. So it is also having the anti-arrhythmic activity. Next, fluorocyanide hydrochloride. So this comes under the class 1C anti-arrhythmic agent. So it is used to help and restore the normal heart rhythm and conduction in the patient with premature ventricular contraction. So ventricular tachycardia and or Parkinson-White syndrome. So this drug is mainly used to help to maintain the normal heart rhythm. And this is the structure and this is the IUPAC name, that is 4-chlorophenyl, 2-phenyl, and 1-propane, 2-L, pyridine, 4-L acetamide hydrochloride. See here N, 4-chlorophenyl, 2-phenyl, and 1-propane, 2-L, pyridine, 4-L acetamide hydrochloride. So see here, this is the acetamide structure. Here it made it acetamide structure. In the second position phenyl group and here that is pyridine 4-L. So fourth position is attached, so 4-L. And here in the first position 1, 2, 3. 3 carbon atoms are the propane. So the second position of the propane is attached to the pyridine. So it pyridine. So it is 2-L and here 4-chlorophenyl hydrochloride. See here 4-chlorophenyl, 2-phenyl and 1-propane, 2-L, piperidine, 4-L acetamide hydrochloride. So this is the structure and IUPAC name. And properties are, it is a white crystalline powder and it is soluble in DMSO and water and ethanol. And pharmacokinetics, it is the oral intravenous route of administration and it is metabolized in the liver and excreted through the urine. Adverse drug reactions are headache, dizziness, sleep disturbances, and central nervous system effect when the drug is orally administered when we compare to the intravenous route. So if the drug is administered through the oral route, means central nervous system effect is more when we compare with the intravenous route of administration. So uses, it is used to reduce the ventricular arrhythmias and tachycardia, means reduce the blood pressure, and also it has the anti-arrhythmic agent. So these are the drugs which comes under the class 1. Next, The class 2 is also known as beta blockers. So here, the mechanism of action, the drugs will act by blocking the beta adrenergic receptors which are present on the nodal cell. So it will suppress the rate of the ectopic pacemaker activity which is mediated by the sympathetic stimulation. And in this drug will control the arrhythmias provoked by sympathetic stimulation, and these drugs are considered to be more safe when we compare with the other arrhythmic agents. So the beta blockers are used in arrhythmias include propranolol, esmolol, sotalol, and acebutolol. So these are the drugs which comes under the class 2. That is beta adrenergic blockers. So what it will do, it will block the beta receptors which is responsible for causing the arrhythmias. So in this first drug is sotalol. It is the non-selective beta blockers with potassium channel blocking activity. So it is the beta blockers and combined with the potassium channel blocking activity. So it differs from the propranolol by following some of the reasons, like it has no membrane stabilizing effect and it increases the ERF of cardiac tissue, and it prolongs the QT interval, and it does not increase the heart rate in isolated cardiac tissue, and also it will enhance the duration of the monophasic action potential in the both atria and ventricles in dose dependent manner. So this is the structure, and this is the IUPAC name, that is N4,1-hydroxy-2-propane 2-YL amino ethyl phenyl and methane sulfonamide. See here N4,1-hydroxy-2-propane 2-YL amino ethyl phenyl and methane sulfonamide. If you see the structure here, this is the phenyl, and in the fourth position, two carbon atoms means ethyl. For this ethyl, in the first position, hydroxy group is attached. This is amino, 3 carbon atoms means propane. The second position is attached to the amine, so it is 2-YL. In the first position, this is the methyl, and this is a sulfonamide. See here, 4, 1-hydroxy, 2, see here 2-propane, 2-YL amino ethyl phenyl methane sulfonamide. So this is a structure and IUPAC. Properties are white or almost white crystalline powder, and it is soluble in water, insoluble in methylene chloride. Pharmacokinetics are, it is an oral route of administration. It undergoes a first pass metabolism in the liver, and it is eliminated in the urine in unchanged form. Next, adverse drug reactions are blood division, chest pain, confusion, and unable to breathe properly, dizziness, faintness, fast or slow, irregular heart rate, nausea, vomiting, headache, more sweating, swelling of the face, fingers, and legs, tightness in the chest, unusual tiredness or weakness, loss of appetite, loss of hunger, and diarrhea. Uses, it is used to treat the hypertension, and also it is used to treat the angina and arrhythmias. So it has some three activities, that is anti-hypertensive agent, anti-anginal, and anti-arrhythmias. So it will has the both beta blocking agent, and means that is class 2 and class 3, that is positive blocking agent. Next one is class 3 is potassium channel blockers. So here what will happen, the prolongation effect is mostly due to the blockage of the calcium channel, although it will enhance the invert of the sodium current, produces QT prolongation. So the cardiac block of the potassium channel increases the action potential duration and reduces the normal automaticity. So in this first drug is uh, amiodarone. So it is the most preferable broad spectrum anti-arrhythmic drug. So it is mainly used for treating ventricular arrhythmias. And also it shows the structural resemblance with thyroid hormone in presence of the iodine in structure. So like thyroid hormone, it also possesses affinity towards the nuclear thyroid hormone receptor. So this is the structure, and this if you see the IUPAC name 2, 4, 2-butyl, 1-benzofurone, 3-carbonyl, 2-6 diiodophenoxy, ethyl diethylamine, 2, 4, 2-butyl, 1-benzofurone, 3-carbonyl, 2-6 diiodophenoxy, ethyl diethylamine. If you see here structure, this is the benzofurone. So benzene and 5-membered ring with oxygen. So it is furone. So it is benzofurone. Here 4 carbon atoms are there. So it is named as a butyl. And this is the third position. The carbonyl group is attached. Here phenyl, for the phenyl in the second and the sixth position, iodine is there. So 2-6 diiodophenoxy. Here 2 carbon atoms are there, means ethyl. Here diethylamine. See here 2, 4, 2, butyl, 1, benzofurone, 3, carbonyl, 2-6 diiodophenoxy, ethyl diethylamine. So this is the structure and IUPAC name. Next properties are it is a white crystalline powder and it is soluble in chloroform and methylene chloride, methanol, ethanol, acetonitrile, water and ether. So it is sparingly soluble in propanol, slightly soluble in acetone, carbon and carbon tetrachloride. And pharmacokinetics, it is oral and intravenous route of administration. So it is poorly absorbed when it is administered through the oral route. So when we compare with the intravenous route of administration, the oral route has poorly absorbed and it is metabolized in the liver and it has the active metabolite that is des ethine, ethine this ethylneodorone. So it is the active metabolite. So it is finally undergoes the metabolism through the liver and it is eliminated through the urine. So adverse drug reactions are headache, nausea, vomiting, fatigue, tremors, loss of coordination, dizziness, stomach pain, insomnia, means can't able to sleep properly, and constipation, uncomfortable body movements, photosensitivity means they cannot able to expose themselves to the light. So when it is administered through the intravenous means it causes depression, hypotension, and pulmonary fibrosis and pulmonary alvo alveolitis. So means inflammation of alveoli. So alveoli is one of the part in the lungs. So in that part, the inflammation will occur and blur the vision. Next uses, it is a broad spectrum anti-arrhythmic drug. So it has been effective in the both ventricular and supraventricular arrhythmias. And it is also used in the atrial flutter and refractory to other drugs. So it will enhances the refractoriness and hence can be used to abolish AV, and tachycardia such as WPW syndrome. So these are the references books for the anti-arrhythmic agents. Thank you.